So welcome everyone. My name is Arianna Gamba. I serve as the Procurement, Policy and Project Officer at Healthcare Without Harm Europe, where I coordinate our contributions to the Sustainable Health in Procurement project, and I oversee our project on the procurement and application of safer disinfectants in healthcare. I will be moderating this webinar, and soon I will explain you the outline of today's meeting and introduce you our speakers, Hulda and Susanne, that are thanked to be here with us this afternoon. I also would like to mention that nearly 100 people have registered to this webinar, which gives already a sense of the interest in sustainable procurement. So we will see more people will join briefly. In the meantime, I would like to remind you that all participants are muted, but if you have any questions, please use the chat box and we will address them in the Q&A session. So, today we will launch the brief on the European Public Procurement Directive and guide you through the sustainability concept that contracting authorities can use to implement strategic and sustainable procurement. Then we will look at how all of this works in practice by learning more about the experience of two leading European hospitals from Denmark and Iceland. But before we dive into our topic, I would like to give you a short introduction about who we are and what we do at Healthcare Without Harm Europe. So we are an NGO that brings the voice of healthcare professionals to the European policy debate, but that also raises awareness and informs the healthcare sector about the importance of the environment. Our vision and mission are to mobilize healthcare leaders and professionals to achieve a sustainable and healthy world by transforming the healthcare sector to protect public health and tackle climate change. In the European Office, we work on several policy areas, namely on the impact of pharmaceuticals in the environment and antimicrobial resistance, climate change and the sustainable production and use of energy, the importance of access to organic and vegetable nutrition and healthy nutrition while reducing food waste, the safe management of chemicals and chemical substitution as per topic of this webinar. And as per topic of this webinar, we work on sustainable procurement, which underpins all the other policy areas. We work on these areas closely with our diverse network of more than 88 members across the European region, and these members are hospitals, healthcare facilities, regional authorities, professional associations, NGOs, just to mention a few. All of this is part of a global network of green and healthy hospitals, the HCWH network, that is made of more than 1,000 members representing 30,000 hospitals and health facilities. I would strongly encourage you and all the participants to join this community if you're not part of it yet. By diving into sustainable procurement, I'd also like to mention that what we do on sustainable procurement in our office. So we follow the implementation of the European Public Procurement Directive and the European Strategy on Circular Economy. We raise awareness on how to make use of the regulatory framework to procure safer and more sustainable alternatives in healthcare. And we currently have two projects related on this. The first, on a global scale, is we are supporting the Sustainable Health in Procurement project, SHIP. This is a 4-year project jointly implemented in 10 countries by the UNDP and Healthcare Without Harm. The core aims of this project are to reduce the harm to people and the environment caused by manufacture, use and disposal of medical products. A second project on which we are working on is called SciCam 2.0, which aims to produce the use of safer and more environmental friendly disinfectants in healthcare settings. doing this obviously without compromising the hygienic and occupational health standards of these centers. All this information can be found on our website, and I would like now to introduce our speakers. So the third one is me. I don't think I need further introduction. I will start then with Hulda. She has more than 20 years of experience in sustainability issues and in green public procurement. She spent the last 4 years in the health sector, where she is responsible for environmental and social sustainability issues. Susanne is the project leader for circular economy at Aarhus University Hospital in Denmark, and the project she will present focuses on improving the quality of recycling of plastic packaging from the hospital. This is done through innovation and dialogue with all parties in the value chain. Now, after this comprehensive introduction, I'm very delighted to show you the brief on the European Public Procurement Directive. While most of the European listeners of this webinar are probably already familiar with this legislation, this brief is part of a policy mapping exercise that aims to support sustainable procurement in countries also outside of the European Union, so they can learn from the experience of other regions. As you can see in the brief, I will go around the page. I'm not sure you can see what I'm showing. I think so. So as you can see in the brief, we started explaining a bit what are the objectives of the directive, and also what are the key elements of the directive that the ship partners can consider adopting into their own regions and practice. On the second page, that I will need to move like this. Okay. So on the second page, we provide a recap and overview of the EU Eco-Label initiative and green public procurement criteria. And then we also include mini case studies from Landspitalis in Iceland. So why this is relevant for the healthcare sector? With more than 15,000 hospitals in the region, which count for circa 7% of the EU GDP, we believe that the healthcare sector is well positioned to influence and lead the transition to safer and more sustainable products and services. So let's look now into the legislation and the policy framework. So this legislation creates more opportunities for contracting authorities like hospitals and health systems to use their purchasing power to choose socially responsible and environmentally friendly products and services for the supply chain. The legal text ensures that the procurers can make a better use of taxpayer money by achieving societal objectives, but also innovation and, for example, by promoting a circular economy. So let's now have a look at some of sustainability concepts contained in the directive that could be adopted into procurement policies also outside of Europe. I would like to start saying that the procedural steps in a standard procurement process have not changed after the implementation of the directive in 2016, since the choice to pursue sustainability objectives still lies with the contracting authorities. So the directive does not require authorities to engage in sustainable public procurement, but it gives them the choice to do so. This legislation, however, resolves many of the legal uncertainties by introducing the concept of the most economically advantageous tender, MIT, which is stated in Article 67. What does it mean? It means that in the tender evaluation phase, public authority can choose from different ways of choosing the winning bid. Being that the lowest price paid to the supplier or the lower cost. The lower cost includes the price, but also other costs incurred in running, servicing, and disposing of the product, and it decides also its environmental externalities. So contracting authorities that choose this option will most likely use a life cycle costing method. And another way to select the winner would be a best price quality ratio that allow the authorities to include environmental and social criteria, but also a price or cost criteria is included in the evaluation. Another supporting tool to public authorities is the use of labeling schemes or their equivalent as a means of proof that certain environmental and social characteristics are fulfilled. And so here I think Hulda will also have more information to add about her experience with labels. So I would like to pass from policy to implementation, let's say, and I'm happy to give the floor to Hulda, who brings experience of Landspitalis, a leading hospital that has been reducing its environmental impact since 2012. Hulda, the floor is yours.
Thank you. Hello, everybody. I'm going to give you a little bit insight on our procurement project, eco-label, and a little bit about the circumstances here in Iceland and Landspitali, and what kinds of criteria we have been putting into. At this page here, you can see a timeline of various milestones that we have reached in our environmental work. Well, I have to update the 2018, but the red rings show that in 2013, for example, we set environmental criteria in tenders for the first time. And I will say to you that this is something you have to do it's not something you apply in one night and everything will be okay. It's a learning process for the procurement officers. And for example, in 2014, we set first criteria and tender on product without PVC, nursing product. And we have been working with this ever since. So I will give you a little bit insight on this. Yes. Well, Landspitali, we are 350,000 in Iceland, and so you can see the numbers. We are still the leading hospital in Iceland, Landspitali, and the largest workplace for employees in healthcare. And it's funded by the Ministry of Welfare, so it's state-owned, and we are supervised by the Directorate of Health, and we have approximately 700 beds. So just to give you an insight of what kind of hospital it is, it's a university. It's a hospital with connections with the university as well. So it's a teaching hospital. Well, in 2012, we set our environmental policy, which we have been implementing ever since. And in our vision, we want to be a role model for environmental issues. And that has been a vision that we can use whenever we are implementing our project. we also prioritized a few projects, or you could see in the focus areas. And I have, you can see here, one of them is to purchase goods and services that fulfill the primary function and have the least environmental impact and the lowest life cycle cost. So that is something that we have been aiming at in our procurement projects ever since. Well, I have, you see some red arrows here. They, of course, the procurement, it is connected to all kinds of, it affects all kinds of other work in the hospital, like reducing waste if you have set criteria, as I will show you afterwards, to reduce waste. And we have been working with disposables, and we have also emphasized to set criteria on having a minimum of hazardous chemicals in various products, even though those are small steps. And also focus on designing an environmentally friendly building. We are building a new hospital here on our place. So yes, this is the policy. This is our circumstances, and just to give you an insight as well on the settings of procurement, green public procurement in Iceland. We are, for example, the largest purchaser of medicine and medical supplies in Iceland, and all tenders are processed through the state trading center. So we have to work with them when in our tenders. And we also are responsible of purchasing for other state-owned healthcare institutions, even though it's optional. But this is, you could say, a center of procurement for healthcare in Iceland. And even though we are not part of EU, we are part of, what's it called? We are a member, we have a contract, and we implement various fields in the legal framework, for example, on procurement. So we implemented the EU directive in 2016. And in this directive, it is easier to set forth environmental criteria. It's more, it's more easier. And here in Iceland, we have had this governmental policy on green public procurement since 2009, even though that governmental offices haven't set forth so much environmental criteria in procurement. We have had this policy, so it is a support, like for us here in Landspítali. At Landspítali, we have worked on various fields of setting forth criteria in environmental work, and we, for example, you could divide it in few steps. It's like just poking our suppliers, like setting forth criteria, like this page is showing us that we want to know what you are doing in the environmental work. So we want to know if they have some environmental management systems. Do our suppliers have some policy? Do they have products? So we are poking on them and showing that this is important for us, because sometimes we do know that the market isn't developed enough to give us what we need, but in that way we are showing that this is important to us. And we also ask for good cooperation with our suppliers, and we ask them to take into account our environmental policy. And we are saying, hey, you have to think about this, and you have to give us some products in the future. And there lies a little problem, you could say. Well, this is a poke from Landspítali, but Landspítali, as you have already seen, is a very, very small healthcare system. So a cooperation with, for example, Nordic countries is of great interest. For us, they are very big, but the cooperation together, and we have much of the same suppliers, so it would be interesting to join forces. We also get a better insight into the development and status of suppliers. We say that we urge you suppliers to minimize waste and recycle, and we urge them to take into account to minimize the waste. And we say this is a text that we set in all tenders since maybe 2016, I think. And we say increased demands will be made regarding products and packaging, and that is something that we have started to do now. When I was discussing to Ariane what should we talk about, I want to show you, those who are outside the European Union, that there are few tools that can help us, because the procurement is a very complicated process, and as a healthcare institution we have hundreds of products that we have to look into, so it can be an enormous project to set environmental criteria in our tenders. We have been using the European GPP criteria, so it on technical equipment, paper, cleaning service, etc. So we have been using those criteria, and they also published Buying Green handbook that could be very helpful for those of you that are starting to work on green public procurement. What is important to take into account? Who I have who do I have to work with, set policy, etc. So I would recommend that you would look into this stuff. Also, in the European Union Green Public Procurement Criteria, you have also technical background papers. I remember when I was starting in setting forth environmental criteria, the ones who I worked with in the procurement offices, they were skeptical. Why are we setting those criteria? Is it can we be charged for that and setting this forth? So it's a good background to have and know why are we setting those criteria, not others. So that's also of help. In Europe and in Scandinavia, we have 2 eco-labels, and it's important to know that eco-labels can be of various quality, you could say. Eco-label that we use and look into are only type 1, according to ISO 14024. And they have to fulfill this standard, and this is a third-party process. And the EU eco-label and the Nordic Swan, which is for Scandinavia and Iceland, those are very developed and reliable eco-labels. And we have been using that a lot, both to implement it in our own organization, but also to set forth and use in procurement process. I will urge you, because maybe you are from all over the world, to go into global eco-labeling network, as you can see the logo over there. It tells you what is eco-labeling, and it shows you type 1 eco-labels in all parts of the world. So that could be of use for you to know. Okay. Yeah, I think I'm in a hurry now. Well, here are 4 examples of what kinds of environmental criteria we have been setting. Here are some criteria on products and packaging, where we say that the products and or packaging shall be latex-free or without PVC, or the cardboard and paper shall be made of recycled fibers. So here are an example of criteria that we set in tenders. Another here with a printer, number 2, there we set criteria on buying service instead of product. So in 2012 we started this project, and we wanted to buy printed paper instead of printers. So we did want to buy service instead of product. And that changes the view of the suppliers on the production of their on their machines, for example. So it was a success. It saved a lot of money, and the supplier focuses on quality instead of quantity, and it saved a great deal of money. We had in the start 1,300 printers all over the hospital, and now we have 300 printers in the hospital, so it's centralized. And the interesting part was that 60% of the money that we did spare was because of toners, because all those 1,300 printers had new toners. Well, we have been setting criteria on suppliers for medical equipment to take back their packaging of the product. We decreased our waste by 6% the recent year. I cannot say that this is because of that, but the waste because of medical equipment is a huge thing, and now they have this criteria, so this urges them to look into their packaging. Well, we also set criteria on electric cars, so that's another thing to look into. Well, I have to hurry, and here we have our own hospital is eco-labeled according to the Nordic eco-label, the Swan, but we have also been making process in all our disposables that we have to have in the kitchen is from plant-based. All the disposable are plant-based. And we buy a lot of eco-labeled stuff, we buy organic products, and we are minimizing the disposable as well. So here you can see our employee, he is having this multi-use packaging instead of styrofoam. So we eliminated the styrofoam in 2015. 130,000 styrofoam boxes were eliminated. So now we don't use it. So I think my time has run out. And in the end, I think I will get some questions. Thank you.
Thank you very much, Hulda, for this great presentation. I think the last example on the reusable packaging, it links also very well to our next speaker. I would like now to give the floor to Susanne to present their circular economy project about plastics packaging. So Susanne, the floor is yours. You can start.
Yes, good afternoon everybody, and thank you for organizing this event and inviting me to join you. As I'm Susanne, and I work at Aarhus University Hospital in Denmark. And I'm going to share with you some of our experiences. We have been focusing on plastic packaging and tender requirements. Just to give you an impression of where we are, compared to Landspitale in Iceland, we are a rather big hospital, but on a European scale, we are an average university hospital. Denmark is this small red country you can see on top of Germany. And to the right, you can see an air photo of our hospital. It's rather new and rather large. We have 10,000 employees and 44 clinical departments and a little more than 1,000 beds. And then we're also very proud to be one of the best hospitals in Denmark for 10 years in a row. So it's an average university hospital in a European context. Such a hospital produces a lot of waste. You can see in 2017 we produced 3,200 tons of solid waste. Only 16% of that was recycled. Then we sent a large part also to incineration, and we have 1% for landfill. However, as waste policies are changing across Europe, so are also the costs for incineration per ton. So that's one factor. Also, we have all the focus on plastic packaging, and in general, we want to improve our resource efficiency. So there is a lot to be looked into and a lot of thoughts on that. We have set a goal of being able to recycle 50% in 2030. We there lean on some of our contacts in the European waste business, who are specializing in working with university hospitals. Some of you may know them, Suez. It's a large global French-owned company, and that is their estimate of what is possible to get out of a hospital. So that is also our aim. We have colleagues like in Landspitale who they're already recycling 30%, if I'm right. And we have colleagues in Holland and Finland who are recycling up to 40%. So there's a lot to be done. We also want to decrease the total amount of waste, but so far we have not worked out exactly what our goal should be, but that's to be found out. We are leaning very much on the ideas in circular economy. Some of you may be familiar to that as a help for how can we think about becoming more resource efficient. The whole idea of the circular economy is that the closer you get to the center, the more resource efficient are you. And also one of the basic principles are that you should divide the finite resource streams from the infinite resource streams. In practical terms, this means that you should sort out organic matter from, for example, plastic, so that you do have separate streams, because if you pollute the finite resources with organic waste, you will lower the quality and the possibilities for recycling of both in the long term. So this is just to share with you a little bit about the mental framework we're using for finding out what can we do about waste. In our hospital, we did a small test. We sorted out 500 kilos of solid waste and found that we had 90 kilos of very, very clean plastic packaging, meaning that 18% of solid waste in Aarhus University Hospital is totally clean plastic packaging. And this is confronting our staff every day. This plastic did not come up in this bin to the right by itself. It is nurses and other healthcare personnel every day who are unpacking a lot of goods. Some of you working in hospitals knows what I'm talking about. So it's really a provocation to our staff, and we want to try to do something about it. We had all this plastic packaging analyzed to see what does it really, what does it consist of. The bad thing is that you can see here on the large pie chart, the big blue part of it, it was not possible for our experts just by visual inspection to identify what kind of plastic is this. We took some samples. We took 20 samples and sent them to the laboratory and had them analyzed. And the reason why the experts could not immediately identify the plastic was that it consisted largely by laminates. And laminate means plastic which consists of different layers of plastic produced together, meaning they're very, very, very difficult to recycle. The good news was that the orange part, consisting approximately 25% of the big pie chart, is LDPE, which we already have a logistic track for, and which we collect, and where there is a market, and where we know the end-of-life situation of this plastic. But the rest, as you can see, are either very small fractions, and it's also combined types of plastic, making it more or less impossible to recycle at large. We also analyzed and divided by different types of packaging. You can see the majority of the plastic we have is flexible plastics, and that corresponds very well with the blue part in the pie chart, where you can see there is a lot of unknown plastic in the flexible parts. There is also a lot of LDPE, which is in this graph, it's orange. And it would be nice, for example, you can see the largest column approximately in the middle. You can see there is a large orange part here, which is LDPE, and this comes from peel packs. Peel packs is often the inner primary packaging for sterile products, and of course we have a lot of that in our hospital. It's a type of packaging which we could easily ask our nurses to sort out. But if we instruct our nurses to sort out all the peel packs, we would have some LDPE, but we would have it mixed up with a lot of other types of plastic packaging. So our conclusion on this picture has been, we will never be able to solve this plastic packaging problem we have just by sorting it. Instead, we are using most of our resources on value chain dialogue. We have identified the 5 largest companies contributing to our plastic packaging waste. They are global suppliers, of course, and I think we share the same to a large extent. And we invited them to come to our place in Denmark and discuss these issues with us. And when we started this dialogue almost 2 years ago, this agenda was completely new to all of us. But we were very pleased that most of the suppliers we invited, they came. And we had some very, very constructive 2 days, and we decided to start working on a very simple product because we expected that the process and the learnings we had to do would be difficult enough. So you can see we started with maybe the simplest product we have in the hospital, and that is irrigation fluids. Everybody of these big medical companies can, of course, produce sterile water and saline solutions. Here the competition goes to the bottle. So we thought this is a good place to start. We have been discussing with them, and we also have been testing some different ways of setting up tender requirements. We have had this product irrigation fluids in a national tender, and there we have been leaning on a design guideline issued by Plastic Recyclers Europe, which is the European Business Association for Plastic Recyclers. And they set up some design criteria for these types of bottles which irrigation fluids comes in. that is mostly PP bottles. So we took the design criteria from the design guideline and turned them into minimum requirements and competitive parameters. Because we had this close dialogue with the suppliers, we knew where to put the barrier in the minimum requirements, because it's essential. In our trade, sometimes there are only very few suppliers, and you rely on these suppliers and to get the goods because you need them in your hospital. So you're not interested in excluding too many suppliers because that could hamper competition and finally the price you pay. So that's important that you know when you set the minimum criteria that you have a close market dialogue so you know your market. And then it is a new agenda. So therefore we also chose to have some competitive parameters. So this is a guidance to the market. What do we really want to see in these type of products? None of the bidders gained more than 50% of the possible points they could get, and this is a good indication, which we knew, that this is a fairly new market, setting up criteria for recyclability of plastic packaging. So this was quite okay for us. The interesting part here is that we, of course, price and functionality also played a role, and these recyclability criteria only weighed 5%. However, the price competition was so fierce, so it was actually the points gained on recyclability who had a strong influence, who actually won the bid. It was not the one with the lowest price, because they also performed worst in recyclability. So this was an interesting message also to the market. The consequence was that those who, even though they were the cheapest, the ones with the lowest performance in recyclability is not in the Danish market anymore. So that's an important lesson and signal to the market. We have been working also with some other tenders. We have been working with non-clinical single-use utensils, where again we are setting in some minimum criteria. We are focusing on a list of non-wanted chemicals, plus we are also applying eco-labels wherever relevant. What is interesting here is that all these single-use utensils are not produced specifically for hospitals, but they are produced for the general consumer goods markets. And even though we have gone far in the criteria we have put, the market has been able to respond. So that is also an interesting lesson for us to learn, that even though we go far, the general market outside hospital world is ready to supply under these conditions. Another experience with dummy products, where we have a different types of suppliers here. We have rather many smaller suppliers and distributors, and here we can see that they are very little prepared for meeting these criteria. So actually we had to move the barrier, so to say, down to lower the barrier in the minimum criteria because of the market dialogue we had, in order not to exclude suppliers which we actually wanted to include. And their reaction has actually been quite strong. They were very shocked when they saw the criteria we were putting in, and we listened, of course, to that. But it gives also, again, a signal. This is a new agenda, and it takes time. So as Hulda also mentioned, it's nothing you go through with overnight. And I think that one of the big important issues here are market dialogue. So that you, first of all, introduce the markets to what you want and give them time to adjust, but also for you to learn about where is the market and where can I safely put the barrier, and then send the right signals and the consistent long-term signal to the market. When we have this dialogue, or when we are applying some criteria to specific tenders, we have some generic types of questions which we work with. They are quite common sense. In which way does this company work with reduction of packaging? Do they include recycled material and secondary and tertiary types of packaging? That's one set of criteria. Also, as Hulda also was mentioning, about take-back systems wherever relevant and possible. And just to have this dialogue with the supplier will help you next time you have this product in a tender, because then you have already mentioned that you want this, and next time maybe you can make a very firm demand on that this is what you want, and now it's known. When we're also talking very much, of course, with the recycling of plastic, there it's very important that we have monopolymer packaging, so that there has been a tendency, and there's also, of course, a necessity of having quite some complex types of packaging, especially in the healthcare sector, because of the functionality of some of the types of packaging we have. There are some types of plastic where it makes more sense to insist on, because there is a market for the recycled material, and that is PP, PE, and PET. It doesn't make sense for you to set up certain criteria, and maybe you set up also a sorting system because you want to sort all this plastic packaging you have in your hospital. But at the end of the day, there is no market for the recycled product. There's nobody who will take it, or if they take it, they will charge you a high price. Then the financial part of it will be a sad story. Also, a very simple thing is to ask for having signs on the packaging how it should be recycled. That in itself makes the suppliers think, okay, maybe there are things we could change to make it more recyclable. What we don't want is PVC. We actually see still PVC in some types of packaging. We also see that there are some hospitals setting up recycling systems for PVC. But here in Denmark, where we still do a lot of incineration of our packaging, and PVC, when it's incinerated, there are some environmental problems with that, so that is, we don't want that. Also, we do not want laminates. Laminates consist of different polymers, and combinations of paper and plastic is also a no-go. We have run a small test, and we found out that on some specific polymers, PP, for example, if there is just a tiny amount of paper in it, for example, from paper labels, it will halve the value of the plastic in recycling in terms of money. And that seriously hampers the business case for us. I think this was I wanted to share with you today. And if you have any questions for me, I would be happy to and do my best to answer them. Thank you very much.
Thank you very much, Susanne, for this wonderful presentation. Since we have many attendees today, we have over 65 participants. We have been receiving also many questions. Due to time constraint, we will try to address most of it. So let's start from Hulda. So we have a series of questions regarding eco-labels, but also on medical devices. I'll try to group them, let's say. So, yeah, one would be regarding medical devices. If you use GPP criteria for medical devices, From Tobias is asking, is giving the example of closed circle anesthesia systems to save anesthetic agents and avoid emissions. Then another related to medical equipment, again for Hulda, will be if you consider medical equipment as a service, like you were doing for the printer. And then related to the packaging of the devices, from Dominica, she's asking, could you say for which type of product the supplier was taking back the packaging? Was the inspection of the packaging an issue? So I will let Hulda start answering these questions around medical devices, and then we will see some questions for Susanne.
Wow, I don't know if I can remember everything. I start with the packaging because I remember that question best. Well, the suppliers for medical devices that take back the packaging, the infection part is of no problem. It's when you are installing big machines and bigger medical devices. It's not about taking back from scissors, etc. We are talking about bigger medical devices. So just to have that clear, maybe I was unclear about that. Let's see about the medical devices, about services. I think that we haven't put that in our criteria, and but I think that some suppliers are. I remember in Nijmegen last autumn there was some discussion about it, but I'm not sure about it. I don't know if it's for us here in Iceland. We are the biggest healthcare provider, but this is a very small market, and for us here in Iceland, that's a big problem when you are setting criteria. You have to take care, as Susan mentioned, on not excluding the whole market. So the dialogue with the market is so important. And like taking back packaging, we have had the experience, like we had some styrofoam boxes with cooling gels. We got a lot of it and filled our containers, and then we just rang up the supplier and said, "Can't you use it again?" "Oh yes, we can." So we started this reusing of those two, for example. So we shouldn't be afraid of talking to our suppliers as well. I don't remember the first medical device question. I'm sorry.
Yes, I will repeat it for you. The other question was about the GPP criteria for medical devices, whether you use them.
Well, we have used them. I cannot. I'm sorry to say. I cannot say. I don't have the percentage of it, but it's like energy criteria in the medical. And medical devices, so like energy savings, some chemicals including in the medical devices, but I cannot give you good numbers about that. So it's a support to have the GPP criteria to look into, and you have to, at least in bigger tenders, you have to see what can the market do, what can we use for now. So often it is you have to look into it and see what opportunities there are for it. I have another question which was privately for me. I don't know if
yes, please go ahead. Yeah.
Okay. What were the challenges at Landspítali that you encountered when implementing the sustainability criteria? I would say the challenges is to you have to teach the procurement officers. You have to, because I'm the only one as an environmental manager. So I came up to them and said, well, procurement is a very important part, and then we have this governmental policy, so we should look into this and that. So, and then I gave them some introduction, so they are willing, they are now on board, you could say. So it's important that the procurement officers, they they learn about it, why are we doing this, and what do we gain from it. So you have to take into account the knowledge and teach about why is this important, and then you have to collect examples. What did we do well, and what could we do better? So, and now we are also in our yearly report on environmental matters. We are counting how many tenders and inquiries we have been using concrete criteria. So, like for have our numbers here. So we have numbers on the tenders, and then we set default criteria like on cleaning agent. We set default criteria on paper and toilet paper, etc. So we don't ask all cleaning service. All of our cleaning service is eco-labeled, outsourced. So we don't have to look into it now. We are just, this is a default criteria. And this is something that the procurement officers, they have learned. But as I mentioned, it's very complicated, all kinds of chemicals, and as a procurement officers, you are not a chemist. So this is, you have to like hold their hands, you could say.
Thank you very much, Hulda. I think now we will look into the questions for Susanne. So there is a question from Manuel Antonio. He's saying, we are developing a project in Central America. One of the main concerns we have is the waste management. The project is related to renal replacement therapies, and as you can conclude, hemodialysis and peritoneal dialysis are therapies that normally produce considerable amount of waste. So they've been trying to know experiences about these issues. Susan, do you have any experience with this kind of waste?
Yes, did I understand it right that we are talking about dialysis liquids?
Yes, I think so.
Yes, yes, we have actually been looking a little bit into this. I don't know about exactly what systems you are running, but we were looking into it in relation to our intensive care preparation, where we have some machines for dialysis, and we enter with the bags of 5 liters of dialysis liquids of different characters. These bags are made out of plastic themselves, and then there is what we call an over pouch. So they're, so to say, double packed. And then there are in cardboard boxes, and these boxes are in even larger boxes. And on top of everything, we have the transport film on the pallet. So we have been looking into this. We found out, for one strange reason, we were in dialogue with the supplier, which is a global one, which you may also be using, and they informed us that we are part of the EMEA market, which means Europe and Africa and the Middle East. And for this market, they supply these over pouches in a non-recyclable way. But for the rest of the world, they supply this product with a recyclable one. So it's a monopolymer HDPE over pouch, and that is of high value. It's a big bag, and it's of high value, and there is a market for recycling it. and it's rather easy also to collect it because I don't know exactly how your working procedures are, but with us we have the patients in one part of the ward, and then we have all the dialysis machines and preparing them in another part of the ward. So it's easy to collect these kind of pouches when you're preparing it, and there is a market for it. I think the thing here is to look into, can you collect it in a fairly reasonable way? Can you transport them through your hospital without getting further contamination? And is there a market for it? Otherwise, the whole effort is wasted. I hope this is a sufficient answer. Otherwise, you're perfectly welcome to contact me afterwards in using email.
Thank you very much, Susanne. We are running a bit out of time. We already passed the hour, but I have another last question for you, and then I would encourage the other participants also to direct your questions to our speakers. You have their contact details there. Susanne, the other question is related to your presentation. How do you verify that the bidder will be delivering at the warehouse PP, PE and PET packaging that you selected in the evaluation? So do you ask for an analysis of the finished product, or do you ask, for example, for a sample during the evaluation?
When we carry out the evaluation, of course we have a written documentation from the supplier, what's in the product. And also for these products, we already knew beforehand what they were consisting of, and it's common on these products to have a small mark in the bottom so that you can see what they consist of. And there are some rules specifying, because of course there's not just this polymer, there's also some additives, and that is what we ask them to in writing. So they have to verify by their signature. We have also been thinking of, and we're putting that clause now in new tenders to be very specific, because a lot of the cheaper plastic products, they come from many different kinds of countries where control and practice is maybe not as stringent as one could wish. So that we said in a clause that we will have the right to take a test and send it to laboratory all through the contract period to make sure that they still perform as we expect them to do. So it's in writing and by visual inspection during the evaluation, and then the clause that during contract period we will have the possibility to send it for further analysis if we are in doubt.
Thank you very much, Susanne. I think this is very helpful and clarifies even further your presentation. So I would like to thank all the attendees to be here with us today, and our speakers for this very interesting presentations. I would like to remind you that for those of you who were unable to join, but also to all the attendees, that the webinar has been recorded and it will be sent together with the speaker's presentation in a couple of weeks. The brief about the European Public Procurement Directive will be launched today. I think you can already find it on our website. You have the link there and you have the link to our newsletter. Subscribe if you want to be informed about our activities and webinars. And I also would like to remind you that the next meeting on Healthcare Without Harm will be in CleanMed 2019, taking place in May in Nashville. So thank you very much for being with us today, and please do not hesitate to reach out to us for any further questions.